Good morning, afternoon, or evening to those listening. Did you know that the old tale, if you smell burnt toast, you might be having a stroke, is just a myth or old wives' tale? That leads me to what I want to talk to you about today, strokes. I have a hypothetical patient. Their name is Mr. Marks, a 68-year-old male. He was admitted to the emergency department at 0600 after what has been diagnosed as a left MCA, middle cerebral artery ischemic stroke. His family has informed that the patient has a history of hypertension. I'll be talking about the pathophysiological and pathogenesis process of the patient's ischemic stroke and his clinical manifestations. But before we get into all that nit and grit, we must first understand what a stroke is and the two types of strokes a patient can suffer from. A stroke is an occurrence of sudden loss of neurological function resulting from focal disturbance of cerebral blood flow due to ischemia or a hemorrhage. The brain does not store glucose, energy for the blood, and neurons can survive for only a short time without oxygen. If part of the brain that is being affected by a stroke is deprived of oxygen for only a few minutes, the neurons die. This is known as cerebral infarction. The two types of stroke, as mentioned before, are ischemic stroke, which occur due to a blockage in the blood vessels supplying the brain. Mr. Mark is suffering from a left MCA stroke that happens when there is a sudden onset of focal neurological deficit resulting from brain infarction or ischemia in the left territory of the brain supplied by the MCA. Hemorrhagic stroke occurs in response to bleeding in the brain. This causes a hematoma to form outside the damaged blood vessels, and because the blood cannot escape, pressure builds up. This is going to be a lot of information about the pathogenesis of an ischemic stroke, but just bear with me. The interruption of blood flow to the cerebral tissue from a thrombus or embolus initiates an ischemic cascade. The ischemic cascade is a series of biochemical reactions that are initiated in the brain and other aerobic tissues after seconds to minutes of ischemia. This causes the mitochondrial production of ATP, the energy-carrying molecule, to halt. Depolarization occurs, and this induces an influx of sodium and calcium and an efflux of potassium. A passive inflow of water into cells to try to maintain homeostasis causes cytotoxic edema and destruction of cells in the infarct core. The infarct core denotes the part of an acute ischemic stroke which has already infarcted or irrevocably destined to infarct regardless of reperfusion. Membrane depolarization also stimulates the release of neurotransmitters such as glutamate, which leads to excessive calcium influx into nearby neurons. This knock-on effect allows the destruction of cells by lipolysis, proteolysis, and free radicals. Mitochondria break down, releasing toxins and apoptotic factors into the affected part of the brain. The injured brain tissue triggers an inflammatory response, releasing the inflammatory mediations, which ultimately lead to cell death and edema. Necrosis begins to set in because the destruction of the cell in the infarct core. Ischemia penumbra around the core has diminished blood flow but preserved cellular metabolism. Areas that are now necrotic tissue are not able to conduct nerve impulses and remain inactive. Functions such as initiating and conveying motor impulses, receiving and deciphering sensory information, and speech control will be interrupted. Now that we have a better understanding about ischemic strokes, let's quickly look at some of the risk factors that might have contributed to Mr. Marks suffering a stroke. There is a higher risk of a stroke in people over the age of 65, which Mr. Marks is. The National Heart, Lung and Blood Institute states that at younger ages, men are more likely than women to have a stroke, but women tend to live longer, so their lifetime risk of having a stroke is higher. A major factor that contributed to Mr. Marks having a stroke is his hypertension. High blood pressure puts an extra strain on all the blood vessels in your body, making them become stiffer and narrower. This can cause a stroke due to a clot, an ischemic stroke. The first clinical manifestation I would like to point out is Mr. Marks' severe right-sided weakness. To cause right-sided weakness, The stroke has affected the left motor cortex. It is a major player in controlling that side of the body's movement. This also links to another clinical manifestation Mr. Marks is presenting with, right-sided facial droop. This is also better known as facial paralysis. Facial paralysis happens when the nerves that control the muscles in the face become damaged in the brain. When the brain tissue lacks the oxygen needed to keep functioning, there is a loss of control and the side of the face droops. A Glasgow Coma score was taken. The results were 11 out of 15. The two affected categories were eyes 3 out of 4 and voice 2 out of 5, while motor remained 6 out of 6. The GCS shows and links to the last two clinical manifestations that were noted down, the first being incomprehensible speech. The ischemic stroke is affecting the middle cerebral artery, which supplies blood to key parts of the brain that handle speech. The stroke may be affecting the Broca's area of the brain, which helps with fluid speech production, and the Wernicke's area of the brain, which deals with understanding and producing meaningful speech. Therefore, Mr. Marks is not picking the correct words and sounding incomprehensible. The last clinical manifestation noted was right hemianopia. Hemianopia is partial blindness or loss of sight in half of your visual field in both eyes caused by damage to the fibers that transmit visual information from the eye to the occipital lobe. This part is a bit tricky to explain without any visual aid, but imagine two circles next to each other. Now draw a line down the center of both circles. Now to indicate what Mr. Marks is seeing, or should I say not seeing, is both the right side of those two circles. This can lead to bumping into objects due to visual field loss or loss of depth perception. In summary, it is important for nurses to understand the clinical manifestations, pathogenesis and pathophysiology of a disease such as an ischemic stroke so that better care can be given. Understanding something in more detail and in more depth allow you to connect better with your patient, such as Mr. Marks, allowing you to see signs sometimes before the patient sees or feels them themselves. Thank you for listening. This is Malachi Gorange. Thank you.